Good afternoon. I'd like to thank the Partnership for Safe Medicines for inviting me to speak here today. I'm honored to be on the agenda with such esteemed colleagues who are devoted to supply chain security, integrity, and combating counterfeit medicines. There's a lot of work to be done in this area, and unfortunately, a lot more that must be done. So counterfeit and substandard medicines pose direct and indirect threats to the public health, and the risks are very real. As we've heard today, patients who could be you or me, someone in our families, our sister, might have gone to the doctor for a medicine to treat their cancer, but instead received a counterfeit with no active ingredient. Healthcare providers need to be responsible and understand that safe buying practices will greatly minimize the chance of getting a substandard or counterfeit product. Countless people, as we've heard, shop over the internet from the privacy of their own home and order medicines with no advice or care from their doctor and are vulnerable to the flood of substandard or counterfeit medicines circulating the global marketplace. In recent years, there's been progress in improving the integrity of the legitimate supply chain, but there are still some vulnerabilities and challenges. The threats are present throughout the drug supply chain for the full life cycle of a drug, starting with the active and inactive ingredients, the API that we just heard about in the question from Jeff, through the manufacturing and distribution of the finished drug, and all the way down to the dispensing to the patient. The complexity and globalization of supply chains for ingredients and finished drug products makes regulatory oversight more difficult, strains our precious resources, and makes due diligence by all stakeholders essential. Counterfeiters and diverters are becoming more sophisticated in their methods of introducing counterfeit, substandard, and stolen drugs into the marketplace, and we've seen many examples of that today. And with internet drug sales, it's harder for consumers to know if the seller is legitimate. And these challenges are not limited to the US. They are shared by regulators and enforcement agencies around the world. And the risks increase if regulatory and legal systems are weak, under-resourced, and lack the necessary data and information to make sound decisions. So what's needed is a coordinated, well-thought-out strategy that's global, leverages resources and expertise, engages the private and public sectors, is data-driven and risk-based. There are countless global efforts aimed at combating counterfeit and substandard drugs. Many of these efforts has resulted in successes. Many are ongoing. Many are in need of a little push to get off the ground, but they all have one thing in common and the same goal. Unfortunately, this has also resulted in some duplication of efforts and some very well-intentioned efforts that have yet to achieve success because the lead organization has spread itself too thin, put their hand in too many cookie jars. At FDA, for many years, we too have been working on several fronts to further ensure drug supply chain security and integrity and minimize opportunities for counterfeit and substandard drugs to reach consumers. In order to get our arms around all that we are doing and engaged in across the agency and where to target our future efforts, we recently stepped back and developed a strategic framework for our approach and engagement that also takes into consideration roles and responsibilities of other stakeholders. The pillars of our strategy are prevention, detection, and response. Prevention through tighter supply chains and enhanced infrastructure and oversight, early and rapid detection of suspicious products, and efficient and effective response when counterfeit or substandard products are found. Prevention, detection, and response is not a new concept, but when we specifically look through these three lenses at a comprehensive approach, it became more clear where FDA's efforts can best be used and where other stakeholders can engage and should engage. Let's look at each of these pillars. What needs to happen to protect the drug supply and protect patients? First, we need to focus on how to better prevent counterfeit and substandard products from entering the market. This can be accomplished through improving supply chain integrity and security. As John said just before me, that our main focus is looking at securing the legitimate supply chain. Tightening the legitimate supply chain to make it more closed and less vulnerable to breaches helps keep the bad stuff out and the good stuff in. Ensuring transparency and accountability in the manufacture and distribution, upstream and downstream across the life cycle of the product is important for prevention, as well as understanding, mitigating, and containing the risks to supply chain security and integrity, including improving global intelligence and data gathering and using risk modeling. We also believe it's important to enhance regulatory and legal infrastructure and oversight here and abroad. As I said earlier, there are roles and responsibilities for all stakeholders. Industry is essential in supply chain integrity, as it is accountable for the quality and safety throughout the product life cycle. Regulatory authorities help prevent counterfeit and substandard products by promoting and improving compliance with science-based standards and regulations and good regulatory practices. Regulators also need to better leverage their individual and collective resources through partnerships among other regulators, law enforcement, industry, and the public. Second, we need to better detect these potentially harmful products, either before they enter the supply chain or once they are in distribution on their way to patients. We need to improve surveillance. This morning and this afternoon, we talked a lot about improving surveillance. We need to do this in a systematic and risk-based approach to determine where these products are and how they are moving through the supply chain and marketplace, and share this information with regulators, law enforcement. We need to improve the efficiency of confirmation of harmful products, including enhancing laboratory capacity around the world and advancing detection technologies and tools. Better detection strategies and approaches will help our identification and investigations of suspect product. Lastly, we need rapid and effective response when these harmful products are found. We need to enhance enforcement activities and tools, implement effective notification systems for confirmed incidents, and ensure efficient removal of these products from the market. Rapid response to remove bad product from shelves is essential. Also, key to this is improving stakeholder vigilance and awareness. On that note, I want to commend the Partnership for Safe Medicines for the work that it has done in raising awareness and educating the public and stakeholders to enhance vigilance. Prevention, detection, and response. We are asking ourselves, what is it that we are working on to further these goals? And how can we get the biggest bang for our buck from our efforts and collaborations? We need to learn to say no, and looking at it from a prevention, detection, response, and where we can best use our resources and expertise helps us to say no when groups and organizations approach us about a very good collaboration, but we have to figure out how to use our limited resources. Most of you are very aware of what FDA has been doing and is currently doing in this area, and you heard a lot today from Dan and John, but let me give you a few examples of what we were doing with respect to these pillars. To better prevent the entry of counterfeit and substandard products from entering the marketplace, we are working on improving transparency, accountability, and integrity of the supply chain. We're focusing on convergence of global standards and raising the standard for good manufacturing practices, good distribution practices, good pharmacy practices, good pharmacovigilance practices, and good importer practices. GXPs. We're implementing and working on traceability and track and trace, including serialization, and I'll mention more about this in a little bit. And we're enhancing our risk-based surveillance and sampling and testing, because we can't sample the market, just the entire marketplace. We're improving our global intelligence and data gathering by looking at new ways to evaluate risks and developing risk models. And we're working with U.S. procurement agencies that purchase and distribute drug product in lower income markets to identify strategies that further ensure the security of their supply chain in these extremely vulnerable markets. To better detect these potentially harmful products, either before they enter the supply chain or once they are in distribution, we are focusing on improving information sharing and communication. You heard a little bit today about the WHO's global surveillance and monitoring system. FDA has provided the support for the development and implementation of this system. It was recently launched. It went from pilot stage to full use for global use among regulators worldwide. We are also working and developing, including with the help of Jeff Gren from Commerce, developing a single point of contact scheme to help improve communication, to know who to contact in each country for different issues. We're developing and implementing detection technologies, new tools. FDA developed a handheld device that uses wavelength detection to detect counterfeit drugs and packaging, currently called CD3. To better respond in the most efficient and effective manner using the tools that we have available, we're enhancing our enforcement activities and tools. And as you heard earlier and just heard from John, the FDA's Office of Criminal Investigations leads domestic and global efforts to investigate and enforce against these types of criminal activities. We're improving stakeholder vigilance and awareness. Last year, we launched Be Safe RX, which educates consumers and healthcare professionals about how to buy safely online. This year, we have engaged the healthcare community, including which are new stakeholders in certain areas, to help increase the awareness of how risky buying practices have led to the purchase of unapproved and counterfeit drugs by the certain medical clinics, which you heard about earlier. So looking across the pillars, FDA is a leader on several global efforts, two of which I'll mention here, and you already heard a little bit about Pangea, so I won't repeat that. The first is a World Health Organization's member state mechanism. Although this was a long time coming to get off the ground, there is finally agreement and momentum among WHO member states to work collaboratively on efforts to combat substandard, falsified, and counterfeit medical products. A work plan is close to being finalized, and it provides a number of opportunities for other global and regional efforts and tools to be leveraged and used more broadly around the globe. The second is APEC, the Asia-Pacific Economic Cooperation Roadmap for Global Medical Product Integrity and Supply Chain Security. FDA is a project lead on this 5-year APEC-funded project that started this year. And it's not just focused on APEC countries. It includes WHO, members of the EU, African countries, and USP. So even though it's focused in APEC, we were including broader representation. The goal of this project is to develop and implement a roadmap and strategic plan for supply chain integrity and security. This is a collaborative effort with regulators, industry, law enforcement, and others. And right now, 8 working groups are doing gap analyses in their areas of focus. These are looking at distribution practices, manufacturing practices. I'm not going to mention them all, but they're looking at track and trace and internet. And so as each of these groups are looking at what's needed in terms of tools, guidance, and training programs. And for many of these areas, either the working group participants or other organizations will develop what's needed or adopt tools, guidances, and training programs that are already available. This is a very exciting effort for FDA, and we're looking forward to working with others as this unfolds. We also have new tools. FDASIA was mentioned earlier, or some people say it FDASIA. I call it FDASIA. It was new legislation that was passed in July of 2012. There was an entire section in there providing new authorities for drug supply chain, giving FDA new ways to help in the areas of prevention, detection, and response, and improving supply chain integrity and security. I'm not going to mention all of them, but in essence, there are a number of authorities that help us get more information, risk information about the products and about the people who are manufacturing products and importing them into the United States. There are other authorities that help us better in our inspection and oversight of global supply chains. And we also receive new enhanced tools, including increasing penalties, administrative destruction and detention, and other ways to help contain these products and get at the bad guys. In addition, Congress is currently considering legislation that would develop and implement a track and trace system in the U.S. in the Drug Supply Chain Security Act. This system, if fully implemented, cuts across all three pillars of prevention, detection, and response. For over 10 years, FDA has been calling for a meaningful and enforceable track and trace system to protect the public from counterfeit, stolen, diverted, or otherwise unfit drugs that may enter the supply chain. That bill is currently before the U.S. Congress, and it provides protections over our nation's drug supply that reduce the opportunities for counterfeit and substandard products to get into the system and reach patients. Moving forward, we must make sure that we strike the appropriate balance between the need to establish a secure system that protects public health and the cost and looking at the cost and feasibility of the system. What this new law would do is create two phases. The first phase that then leads into a second phase, and it's important. And the first phase is to help build to get to the second phase, which we are looking forward to having it be an electronic, interoperable, unit-level track and trace system that's clear and predictable. And the bill that's currently before the U.S. Congress provides an explicit path forward to such a system for phase 2 and takes into consideration technology available and the capabilities of stakeholders. FDA is looking forward to working with supply chain stakeholders on this and other efforts to further secure our nation's drug supply. So prevention, detection, and response. This is a call to action to think about these pillars. What's your role in the supply chain security and integrity in combating counterfeit and substandard drugs? Does the work that you do fit into this framework? Which pillar does your expertise best align with? Do your investments and efforts align with prevention, detection, and response needs? Are you using your expertise and resources in an efficient and effective way to further what's needed? If not, is there something that you can stop doing in order to further focus on your area of expertise? And can you partner with others to leverage resources to get the work done? These are just a few of the questions that you should be asking yourself and your colleagues. We can't continue to take a fractured approach and duplicate efforts. I'm calling for a more coordinated domestic and global approach that leverages resources, expertise, tools, and training, and engages the private and public sectors. At FDA, we have identified a framework for strategically tackling supply chain security and integrity and combating counterfeit and substandard drugs through prevention, detection, and response actions and activities. We will continue to engage stakeholders and other partners and continue to identify ways to improve domestic and global coordination. We're all on the right path, and we believe that focusing on the three pillars of prevention, detection, and response will help further guide the way. Thank you.